Motor neurone disease (MND), also known as amyotrophic lateral sclerosis (ALS) in many regions, is a rare but progressive neurological condition that primarily affects the nerve cells responsible for controlling voluntary muscle movement. These nerve cells, called motor neurons, gradually degenerate and die, leading to muscle weakness, atrophy, and loss of motor function. Types of motor neurone disease: amyotrophic lateral sclerosis (ALS), the most common form of MND, affecting both the upper motor neurons in the brain and lower motor neurons in the spinal cord. ALS typically leads to widespread muscle weakness and atrophy. In the United States, ALS is often synonymous with MND. Progressive bulbar palsy (PBP) affects the muscles involved in speaking, swallowing, and breathing by impacting motor neurons in the brainstem bulbar region. Progressive muscular atrophy (PMA) primarily affects lower motor neurons, leading to muscle wasting and weakness, especially in the hands and legs. Primary lateral sclerosis (ELS), a rare form of MND that affects only upper motor neurons, leading to muscle stiffness and spasticity but typically slower progression and longer life expectancy compared to ALS. Symptoms: the symptoms of MND can vary depending on the type and which motor neurons are affected, but they often include muscle weakness. This is the hallmark of MND, starting with difficulty in moving limbs, clumsiness, or dropping objects. Muscle wasting atrophy: muscles begin to shrink as they lose nerve signals from the damaged neurons. Twitching: fasciculations, involuntary muscle twitching, often visible under the skin, is common in affected muscles. Stiffness and spasticity, tightness and muscle rigidity may develop as upper motor neurons are affected. Difficulty with speaking: dysarthria, slurred or slow speech due to weakening of muscles in the face, throat, and tongue. Difficulty swallowing: dysphagia. As the disease progresses, patients may struggle to eat, drink, and swallow. Breathing problems: eventually, respiratory muscles weaken, leading to difficulty breathing and, in advanced stages, respiratory failure. Emotional and cognitive symptoms: some patients with ALS may experience changes in mood, behavior, or cognitive abilities, though most people remain mentally sharp. Causes: the exact cause of MND is still unknown, but researchers believe it results from a combination of genetic, environmental, and possibly autoimmune factors. Genetic factors: about 5 to 10% of MND cases are familial hereditary, caused by genetic mutations passed through families. The rest are sporadic, with no known family history. Environmental factors: potential environmental triggers such as exposure to certain toxins, chemicals, or heavy metals have been hypothesized, though none have been conclusively proven. Age: MND most commonly affects people between the ages of 40 and 70, and the risk increases with age. Gender: men are slightly more likely than women to develop MND, though the gap narrows with age. Diagnosis: diagnosing MND can be challenging because its early symptoms are often subtle and similar to other neurological disorders. There is no single test for MND, so doctors rely on a combination of tests to rule out other conditions and confirm the diagnosis. These may include neurological exam, to assess muscle strength, coordination, and reflexes. Electromyography (EMG), a test that measures electrical activity in the muscles, helping to determine if nerve signals are reaching them properly. Nerve conduction studies (NCS), used to test the speed of electrical signals in nerves. MRI, to rule out other potential causes such as spinal cord abnormalities or brain disorders. Blood and urine tests, to exclude other conditions that can mimic MND symptoms. Treatment: there is no cure for MND, but treatments are available to help manage symptoms, improve quality of life, and slow disease progression. Treatment typically involves a multidisciplinary team of healthcare professionals, including neurologists, physiotherapists, speech therapists, and respiratory specialists. Medications: Riluzole, the only medication specifically approved for ALS, It works by reducing damage to motor neurons and can slow disease progression slightly. Edaravone, another drug that may help slow disease progression in some patients, though its exact benefits are still being studied. Medications for symptom relief, drugs to manage muscle stiffness, baclofen, tizanidine pain, excess saliva, or depression can be prescribed. Physical therapy helps maintain mobility, reduce muscle stiffness, and improve range of motion. Exercises can help manage muscle weakness and delay the loss of function. Speech and language therapy, useful for managing speech difficulties and helping patients communicate more effectively. Devices such as speech synthesizers or communication aids can assist those who lose their ability to speak. Nutritional support. As swallowing becomes difficult, patients may require dietary modifications or, in advanced stages, the feeding tube PEG tube to maintain adequate nutrition. Respiratory care, ventilatory support, such as non-invasive ventilation (NIV) or mechanical ventilation, may be necessary when respiratory muscles weaken. Palliative care focuses on improving the quality of life by addressing pain, discomfort, and emotional needs, especially in the later stages of the disease. Prognosis. MND is progressive, meaning symptoms worsen over time. The rate of progression varies widely between individuals, but ALS, the most common form, is usually fatal within 3 to 5 years after diagnosis, primarily due to respiratory failure. However, some people, such as the late physicist Stephen Hawking, live much longer with the condition. People with primary lateral sclerosis (ELS) generally have a slower progression and longer life expectancy than those with ALS. Early diagnosis and appropriate management of symptoms, especially respiratory care, can significantly improve quality of life. Coping and support. Living with MND can be emotionally and physically challenging for both the patient and their family. Psychological support, counseling, and support groups can help individuals and families cope with the emotional impact of the disease. Occupational therapy and home modifications can also make day-to-day activities easier. Ongoing research. Researchers are continuously investigating the causes of MND and exploring new treatment options. Promising areas of research include stem cell therapy, investigating the potential to replace damaged motor neurons with healthy ones. Gene therapy, targeting specific gene mutations that cause familial ALS. New drug therapies, looking at ways to protect motor neurons or slow disease progression. Would you like more details on specific treatment options or current research advancements in MND?